major themes that, for me, have come out of this is talking about differential diagnosis, and Dorothy sort of set us up with this idea that we could look at underlying causes, and she said that maybe genes are not going to help us with that. We look at presenting difficulties, so Courtney's talked about the DSM criteria, Vicky talked about distinguishing from ASD, and Julie talked about overlapping needs. And then also possibly looking at response to intervention, and Vicky and Claudine have addressed that in some way as well. And the other issue is, what name do we give this entity? So in terms of non-verbal IQ, we've seen that non-verbal IQ scores decline with age in children with language impairments. Most SLCN children who change diagnosis change to MLD, which fits with that. The question that Courtney raised is, should this be a criteria for language disorder? If so, what level of non-verbal IQ should be the cut-off? On what test and at what age, given that it decreases? And the other question is, can you have an intellectual disability and a language disorder? So is it exclusionary, or can you actually have both diagnoses with one being primary? In terms of ASD, the main thing that distinguishes ASD from language impairments on the DSM is the repetitive interested behaviours. Children are switching from SLCN to ASD and vice versa. We've heard that from many people today. There's lots of overlapping profiles and needs. Interestingly, ASD children get more LS, or children with a diagnosis of ASD on their statement, get more LSA and SLT support despite having on average better language skills, which we've just heard. Social communication disorder, Courtney raised this issue of, should this actually be a separate category? Is it required as a separate category? Many meet the criteria for ASD, others have got structural language difficulties, so could they just be subsumed into these two groups? Something maybe that we can discuss. So a possible solution, which Courtney proposed and I'm sort of adding to a bit, is that you should specify the current presentation of language impairment on several dimensions. And Courtney mentioned this severity rating scale, so based on 1 to 3, so 1 requiring support, substantial support versus very substantial support, and I think this needs to be very carefully specified, particularly as if this is going to dictate the kind of support that they actually get. But I'm wondering whether we could also give multiple diagnoses, and by adding in the severity ratings for all the different diagnoses, you'd actually reveal the primary diagnosis. So if the ASD is level 3 and the language impairment is level 2, well, they've got both, but they're primary ASD, and if it's the other way around, then they're primary language impairment. So what I've got here, which unfortunately hasn't quite worked as I wanted, these are 4 children who I knew quite well, who have a particular profile. So 3 of them have a severe language disorder. They were all in the school, and 2 of them no speech disorder at all, and no ASD. This green one, a very severe speech disorder, but also no ASD. This one here in purple, though, language disorder at, I would say, level 2, but also a diagnosis of ASD, probably at level 2. So I'm not sure quite what you'd say was her primary impairment, and there's certainly a debate as to whether she should be here or in a school for children with ASD or some other support. But by sort of profiling these different issues at a severity level, it would actually maybe indicate, both show what their range of difficulties are, but also give you an idea as to what's the primary need. This was supposed to be all animated, so you've got one child at a time, but so you're going to have to look at it all. So this is within the language disorder. So we've looked at the multiple diagnoses, but if within the language disorder, Courtney gave us a list of the different things you could look at. If we could give each of those a severity rating as well, then you would get a nice profile. So you wouldn't have, okay, these children all have a language disorder at severity level 3, which doesn't really tell you what to do. But if you have this, you'd have your social communication here, and some of them don't have a problem with that. The one with the diagnosis of ASD as well definitely did. Language pragmatics becomes a bit more of a problem for some of them. Receptive language, an issue, and expressive language as well. I'm not sure about getting rid of the receptive expressive distinction, because there's one child I knew very well who had pretty good comprehension and inferencing, but very severe expressive language and speech and phonology and literacy difficulties, so hardly able to express himself much at all, but in context could understand most of what you say, and on listening to paragraphs, for example, got a standard score of 10, which is completely average. So those kind of children, I think you do want to have some way of distinguishing expressive and receptive, although most children, I agree, especially at the severe levels, do have difficulties with both. But maybe this kind of profiling could include diagnosis and also give indications for intervention as well. And this is just combining the two, showing you the different children, thinking whether we need the SCD diagnosis that Courtney said, but that it includes conversational social skills and language pragmatics, and also narrative and expository discourse. And so for some of these children, it wouldn't make any difference, but for some of them, they're quite good at some aspects of the social communication disorder, but bad at some of the others, which are more the language-based ones. So I think maybe having it in as part of that language disorder is helpful if you could separate out the bits and say where are they good and where are they not so good. Differential diagnosis in terms of response to intervention has been mentioned. I think this is particularly important for language delay, which we haven't talked about very much, but Vicky was talking about children who resolve and actually probably don't have a persisting problem. I think we need to distinguish between children resolving, as in being cured, and children responding to intervention, i.e. getting better but not cured, which Claudine mentioned that a lot of them responded and improved with the oral language intervention, but they still had problems at the end of it. So maybe if children resolve with a language-rich environment or good universal services and good input in the schools, then maybe they've actually got a language delay. Maybe part of the way of diagnosing a disorder versus a delay is actually, did they respond to that general good environment? And if they didn't, then maybe it's a disorder. And if they did, maybe it was only a delay and it could have been because of social disadvantage, English language learners, etc., as Julie discussed. So if they don't resolve, but then the question is, after how long and by what age, it's probably a language disorder. So I remember Eva saying we had a child that went to tribunal where they were saying at 12 he's got a language delay. I think if you've got a delay, if you've still got a language problem at 12 and you've been in a language unit, etc., it's not a delay, that's a disorder. I mean, just because it's behind doesn't mean, I think the delay we need to somehow say it's got to, if it responds then that was a delay, if it hasn't responded it probably isn't, and you need to do something about it and give them some intervention. So predictors of response to intervention, Claudine's talked about non-verbal IQ, correct? Have I interpreted this right? So that non-verbal IQ didn't affect their response to oral language intervention, everybody improved, but those with lower non-verbal IQ did not respond so well to terminology and reading. You needed the higher IQ. So for literacy intervention it seems responded, but the oral language, it wasn't really a predictor. Is that correct? Yes. Receptive language, Vicky showed us often doesn't improve with targeted help, and she suggested that maybe intervention provided at an older age is more effective.
Well,
or not, maybe not more effective, but
following up on what you said about are delayed,
yes,
we know
that we shouldn't maybe waste our money on the children who are oral services on the children who are going to resolve anyway. But maybe we need to think about how to work that. But there's some issues there that need discussing.
Yes.
I just thought I'd add in a couple of my own slides on non-verbal IQ and progress. This is a study that we've finished and we're hoping to submit soon. And this is progress with therapy. So underneath the red line didn't make any progress, and above the red line did. So, and it was a randomised controlled trial, and the children who received the therapy improved when they got the therapy, and not when they didn't. The two children who didn't improve, one of them is well within the normal range. This is the no man's land area Courtney was talking about, 70 to 85. And this is slightly below it. Doesn't look to me like these ones are responding any less well than these ones, possibly even slightly better. And the ones who didn't respond are in the normal range or in the grey area. And this is a study I did earlier, which I went back and looked at. I haven't looked at it this way. There were 3 children who didn't respond to the therapy, and they were within the normal range for SLI. And again, these ones in the no man's land don't to me seem to be any different from the ones who are higher up. Their response to therapy looks very similar to me, doesn't seem to make a difference. So I want to add in to this predictors of response to intervention that non-verbal IQ doesn't appear to affect response to oral language intervention, although possibly to literacy. And actually the study we've just done shows that we can improve receptive language with targeted help, and these were all older children, so it does seem that you can improve older children, but not resolve. None of these were cured, so that they did improve. And the other issue is, what name do we use and does it matter? Specific language impairment, language disorder, SLCN, SCD, should we use that as a category? So, over to you. These, I think, are the main themes, which I will leave up so that maybe we don't get stuck on one theme and we can be drawn back to discussing everything. And I'll go to Aoife, who's going
I
to
just wonder whether people might need 5 minutes breather to use the facilities, stand up,